Today, I know we want to be mindful of time. So good morning and welcome to the Ohio Children's Trust Fund's first April Child Abuse Prevention Month webinar. My name is Nicole Silliman and I'm the Executive Director for the Trust Fund. And I'm excited to be here with all of you today and just want to express my appreciation that you've taken the time to join us. I want to remind everyone that during the month of April, we're going to be hosting weekly presentations. They're going to be each Thursday at 11 a.m., highlighting various projects throughout the month. So if you're interested in joining these presentations, please visit our website at octf.ohio.gov. We will also drop a link into the chat that connects you to the site on our website where you're able to register for all of our different Prevention Month webinars. Additionally, I just want to call out that this year, the Trust Fund is celebrating 40 years of service in the prevention space. And we're excited to share that we have also launched a new awareness campaign, the Ensure They Shine campaign. This campaign highlights that children possess a unique ability to light up our lives, and we can all be a part of nurturing their bright spirit with love and care. We encourage all of you to join us in educating, engaging, and encouraging the best for our children and youth as we ensure they shine throughout the month of April as well as year-round. We will be providing on our website things such as awareness campaign assets, social media toolkit, and a whole bunch of other resources if anybody locally would like to help promote the Ensure They Shine campaign. Before we start today's presentation, I also want to review some housekeeping items. We kindly ask that you remain muted throughout the presentation. We are going to make sure that we have time towards the end if you would like to ask any questions or would like to engage in any sort of discussion around the topic. We also just want to remind everybody that this presentation will be recorded. It's being recorded right now, and we will make sure that it's uploaded onto our website. So if anybody couldn't attend or stay for the whole thing, or you want to share this with somebody else, you'll be able to do that. If you need a certificate of attendance, please indicate so via the chat. Please provide your full name and your email address, and one of our team members will provide that to you after this presentation. I would now like to introduce our presenter, Susan McDonald of Knox County Head Start. Susan has coordinated the Knox Parent Support Initiative since 2017, serving parents and caregivers of children and teens in Knox County, Ohio, with a full suite of PPP intervention levels. She is an accredited PPP practitioner in positive parenting program levels 2 through 5, including Fearless PPP, and has enjoyed a career in nonprofit leadership and corporate training for over 30 years. We are so excited to have Susan with us today, sharing all of her knowledge about the PPP Fearless model. And so with that, I will turn it over to Susan.
Awesome. Thank you. It's wonderful to be here. Welcome, everybody. I'll give you a little bit of information about myself and us, and then I'm going to kind of move into the agenda that we're going to have for our time together. As Nicole said, my name is Susan McDonald, and I coordinate the Knox Parent Support Initiative. We're located in Mount Vernon, Ohio, and we serve parents and caregivers who live or work in Knox County. We've been around for about 7 years, and this is a community collaboration. Our backbone agency is Knox County Head Start. We did our first PPP training in any level of PPP about 6 years ago, and we now have practitioners trained in just about every level of PPP, not all, but almost all. And I do need to give a shout out to our funders. Our primary funders are the Ariel Foundation, United Way of Knox County, and of course, the Ohio Children's Trust Fund. So today I'm going to share a little bit about Fearless PPP as a support to families parenting an anxious child or teen. So first, I'd like to welcome everybody here. It's good to see that we have some folks interested in this and give you just a thumbnail of what we're going to be covering today. I'm going to share a little bit about Fearless and how it can be an important tool for you as a parent educator, and some of the experiences we've had here in Knox County. There'll also be some time for some Q&A, and as we kind of make our way through our time together, I'd love to know what brought you here. So, and I can see some of you, but not all of you. But I'd love to know that, and you can use the little emoji way of telling me, or you can actually, if you're physically watching and I'm seeing you, raise your hand. But if you are an actual parent educator, that you have the opportunity to do parent education as part of your daily work, can you just put a hand up or an engagement that says that's what brought you here? And also, if you're someone that works with families and children in particular to navigate an anxiety diagnosis or concern, also feel free to let me know that that's why you came. And if you're actually a family that's navigating an anxiety or diagnosis with your child or teen, right? So bottom line is that some of us might have raised our hand for all of those. As a parent educator, as a person that works with families and mostly families, not necessarily always children and teenagers, but families of children and teens with an anxiety diagnosis, and also as a parent who was several years ago navigating that myself. A lot of people come to Fearless for a lot of different reasons. So I thank you for letting me know kind of what brought you here. Let's go ahead and talk a little bit about, let's see if I can get my thing to progress here. Let's see. Oh, goodness. There we go. So what is Fearless? Fearless is first and foremost what one of the co-authors of the program, her name is Dr. Vanessa Cobham, shared. It allows parents who are concerned about their children's anxiety to get immediate help. And I think more than anything else, it's a nuts and bolts way that parents are able to actively, proactively engage with their children around helping them manage anxiety. So Fearless is a parenting intervention, and it's designed to empower parents to take on that role that they have as being the most powerful agent for change for all of their children. It's an evidence-based program designed in a kind of a suite of programs that are flexible in delivery and in treatment of childhood anxiety. And there are several formats. The format that is kind of a toe in the water or a dip into Triple P is a 2-hour parent seminar that gives parents the opportunity to learn a little bit more about recognizing and responding to anxiety in their child. The delivery that we're most familiar with is the Fearless, the Fearless group, or the 6-week group that we do. You can do that on both an individual or a group. Triple P likes us to keep it at about 12 parents or caregivers. And that allows for a parent to receive about 9 to 12 hours of parent education. And that can also be done as an individual or one-on-one. There's also a way that you can use the material to serve, to deliver as a 6-hour workshop, and with about an hour for breaks. And that is a one-day workshop, or it can also be split into 2 3-hour workshops. The group and the individual programs are the intensive interventions that support parents or caregivers of children ages 6 to 14 who have a moderate to high level of anxiety that's negatively impacting their life. So let me give you a little overview of what those 6 sessions or that one-day workshop or those individual sessions include. And I'm going to do a little bit of a deeper dive into what each of these sessions include. And I do want to kind of give you some visuals of actually what the workbook looks like and that kind of stuff. So Fearless Triple P is based on more than 10 years of research, and it helps parents understand more about anxiety, how they can support their child's ability to manage fear and worry, and become more confident and emotionally resilient. It offers easily accessible parenting guidance that can be used at home to support children and teens' mental health and well-being. The Fearless Seminar, as I talked about, introduces parents to some information about anxiety, provides some positive parenting strategies, and supports the development of behavior of children with anxiety. The 6-week session, which I'm going to talk more about right now, is again, can be delivered in 6 weeks. It can be about 2-hour sessions each week. It can be delivered in individual sessions, one-on-one, and it can also be done in a workshop format, either all in one day, about 6 hours with some time for breaks, or 2 3-hour workshops. And it helps provide a deeper dive to help parents learn new cognitive behavioral strategies for anxiety management, and encouraging them to apply them not only to the children, but to themselves. And so these 6 sessions includes anxiety and what anxiety looks like and how it develops, promoting resilience in children, modeling and the way children think, behavior, avoidance and exposure, and parental strategies for responding to children's anxiety. And then the last session is focuses more on constructive problem solving and how to promote it and maintain gains that over the 6 weeks or the workshop time or the individual sessions, the progress that you've made. Each parent receives a handy dandy notebook, and it gives the parent the opportunity to, throughout the process, not only be learning the information, but also looking at some specific ways, either through group exercises or individual exercises, how they're going to apply that to their own family, to their own children. The content itself is the opportunity to work through the workbook. There's some teaching and facilitating by accredited providers. And then there's also video that is used strategically throughout the process. So there's a little bit of being able to understand and see how these strategies can be applied and worked. So I want to do a little bit of a deeper dive into those 6 sessions. That first session of understanding anxiety is really gives a family a chance to think about the ways in which anxiety is impacting the family, and also a better understanding of the factors that may have contributed to their child's anxiety. By the end of the session, the hope is that parents going to be able to describe anxiety and how it works. They're going to be able to identify 3 components or systems that are involved in anxiety. They're going to be able to understand how anxiety develops and continues. They're going to be able to set some goals for change for their children, but also for themselves, and start keeping track of their child's anxious behaviors. One of the things that you'll find if you're familiar with Triple P at all is that Triple P not only gives parents the opportunity to look at goals for change for their children, but goals for change for themselves and their own behavior. Particularly with anxiety, these first 2 sessions really help a parent identify how they're modeling anxiety and how they're impacting, how their child is observing them manage their own anxiety. So that second session promotes resilience in children. And of course, resilience is what we want because, bottom line is anxiety isn't bad, right? I was anxious when I started thinking about doing this workshop. And I was anxious when I was putting it together. And I was anxious 10 minutes ago when I couldn't get the PowerPoint to kind of get up there. But it also made me pay close attention. It made me get ready for something that I wanted to do well. So anxiety is a fact of life. And our kids, knowing that anxiety is something that is part of how our brain works and can and is the goal is not to have no anxiety at all. It's how to manage our anxiety. So we're promoting resilience in children, and really that session again focuses on parents looking at how they are promoting resilience in their children. It really focuses on understanding and accepting and recognizing feelings, and how to express them appropriately. It gives them parents an opportunity to look at some strategies to help their child deal with uncomfortable feelings. Promoting resilience. I think one of the things that I like about this session, it talks about the anxiety octopus. And when we think about the anxiety octopus, an octopus just has tentacles everywhere, right? And what we want kids to be able and teenagers to be able to know is that anxiety is going to exist. If it's impacting your life, so it's keeping you from doing things, coping with anxiety are some tools that we need, and that we need to be, our kids need to know that they can be the boss of their anxiety, and the anxiety is not going to be the boss of them. And being able to control those tentacles of that anxiety octopus is one of the key points of being able to promote resilience. So by the end of that session, parents will be able to identify the building blocks for emotional resilience, and also use specific strategies to encourage their children to express, tolerate, and manage upsetting or uncomfortable emotions more effectively. It's hard as a parent to watch your child struggle. It's also really important as a parent to allow your child to feel confident that they are able to cope in uncomfortable situations. And we'll talk about that a little bit more when I go over some of the other sessions. Two things one thing that I really like about each of the Fearless sessions is there are very hands-on ways that we are able to utilize strategies with our kiddos. And as we are working with parents as parent educators, being able to have some really specific ways that we are able to help them identify a goal and then be able to identify strategies and to try those strategies. I'd have to say that my favorite delivery of Triple P is the 6-week model, because it does give parents the opportunity to kind of use what they learn. The other, if it is in that one-day workshop, it's still important. It's still going to be valuable. But I tell you, being able to spend a week using the strategies that you've learned and being able to come back and talk with other parents about what's worked well or what you would change is important. So one of the things I really like about this session of promoting resilience is it teaches kids how to use coping cards, which may be something that you're already familiar with, but helping them create their own coping cards and when to use those. So session 3 it's talking about setting a good example, modeling, and encouraging realistic thinking. We learn a lot in this session about how children think, and how anxiety impacts that. And children learn from and follow the example of the important people in their life. So their parents and caregivers are on the front lines of being able to be those people that help shape behavior and help shape response and help shape the use of strategies. So parents are as role models for children, not only in terms of behaviors, but also in ways of thinking. It'll also focus on learning anxiety management strategies that we can start as parents to model for our children. We all know that our children will do what we do as opposed to just do what we say. And that is very true when it comes to how we model anxiety responses as well. This session also talks a lot about the important connection between thoughts and feelings. So I'll talk a little bit more of that in a second. But by the end of this session, parents should be able to understand and model behaviors and ways of thinking to their children and recognize the importance of setting a good example. They'll be able to describe how parents can, without meaning to, communicate a sense of danger, and recognize the role of thoughts in the development and continuation of anxiety, along with describing some common thinking traps and how to get out of them, and practicing flexible and realistic thinking with our children. One of the things that I really like from this session is the ABC model that we talk about in this session, the linking thoughts and feelings and reactions, looking at A as an activating event, B as beliefs or how a person thinks about the event, and C is consequences, or how they feel emotionally or physically and how they behave. There's a good example that that they use to explain that. You cook a meal for a relative who had just driven a whole bunch of time, a long distance to get to you, and they are pushing their food around on the plate. So that activating event, if our belief is that they don't like what we cooked, um, and uh, and then the consequence is we might feel inadequate, we feel hurt, we might, our face might flush, our heart might beat a little bit because we're anxious, and we might just get up and leave from the table and be angry or frustrated. If our belief is that they're just probably tired from traveling and they don't feel like eating a big meal, we're probably sympathetic. We probably don't have any kind of physical things that are happening with our body. We're not getting flushed, our heart's not racing, our palms aren't getting sweaty because we're anxious. And we might even reach out and say, hey, how are you feeling? Would you like to rest? And when we teach our children, when parents are able to teach their children how to interrupt those thoughts and link those thoughts and feelings and reactions, when it comes to that anxiety octopus and being able to be the boss of anxiety and not have anxiety be the boss of you, starts to get some real teeth in it. So the fourth session is the way you behave, and avoidance and exposure. And for any of us that know anything about anxiety, we know that avoidance is kind of like that gasoline can that just stokes the fire. And being able to have exposures, that fire extinguisher that comes and helps to tame it. So in this session, parents learn more about avoidance, which is frankly one of the most common behavioral responses to anxiety. And they also learn about exposure and how to help their child face up to fears in a gradual way. By the end of this session, they should be able to describe the role of avoidance in protecting and strengthening anxiety. They should be able to understand why parents often allow their children to avoid anxiety-provoking situations. It's hard to see our child anxious. It's hard to see our child uncomfortable. And one of the things that parents often do is remove those anxiety-provoking situations. Unfortunately, then our child never learns how to manage anxiety because there's not anxious situations that they're in. So it removes the opportunity to try, and two, removes the confidence that a child or a teenager can have in feeling like they're capable of managing their feelings. It also talks about the principle of exposure and using what's called a fear ladder, which some of you may be very familiar with. But the idea of being able to help a parent set up a fear ladder for themselves, gradually exposing themselves to the thing that is they're most anxious about or afraid to do, and then allowing them to be able to do that same process with their child. And it also will talk about setting up a reward system with our child when it comes to helping our child manage anxiety. It's also important to recognize effort, and it will focus on that a bit, and then also to how to model brave, non-avoidant behaviors to our children. And again, one of the things that I really like from that session is how it equips parents to use a fear ladder. We actually, at the end of this presentation, have a little bit of a reflection from a mom who did that with a child that I'll share with you. Our fifth session of Fearless is my favorite. It is the parental strategies for responding to child's anxiety. And the reason I love this so much is it gives a parent the opportunity to look at how they're already responding to anxiety with their child, coping with anxiety with their child, helping their child cope with anxiety. It gives some ways that are some benefits to using that strategy, and maybe some of the disadvantages to using that strategy, and then also allows a parent to decide if they would like to use that strategy, use more of it, use less of it, using all of the information they've learned in these other 4 sessions. So in that session, they'll learn about effective and less effective ways of responding to children's anxiety. And also some responses that might work in the short term, be better for short term and not work as well in long term. And other strategies that are more beneficial for a child or teen in the long term, and also advantages and disadvantages of those different responses. By the end of that session, parents should be able to identify ways they're currently responding to their child's anxiety, understand the advantages and disadvantages of the most common strategies, all strategies that have already been discussed and unpacked and taught in those first 4 sessions. And also identify strategies they may want to change and new strategies they might want to try. I think it's really important to remember that Triple P positive parenting program in general, and this is true with Fearless, parents are in the driver's seat. This is not a prescriptive model. This is not an opportunity for a child educator, a parent educator, to say, do this and do this, because that's the right thing to do. What Triple P and Fearless allow us to do as parent educators is to be able to say, this is an evidence-based program. There's lots of research that's gone into this, over 10 years that have gone into this. And if you use this strategy in this way, in this consistency, you are likely to have this result. And I think that being able to remind parents that they are the first and best teachers of their children and have the highest likelihood of having immediate impact, that's a real value of the program. All right, and then the last session is constructive problem solving and how to promote constructive problem solving and how to maintain the gains that you have already realized. Again, this is a lot easier to do if you've worked with a person individually or you have worked with a group of people over a 6-week period of time, because there have been gains. If you're doing it in the workshop model, it's really teaching about how to do this as they make their way through utilizing the program at home. So this session, parents are going to be able to learn effective approaches to another effective approach to handling anxiety, and that is constructive problem solving. It really does a really wonderful job of walking parents through the steps of constructive problem solving, so that then they're able to teach that to their children and their teenagers. And we'll also, in this session, we'll review progress the families have made through the program and how to keep up those changes. By the end of the session, parents should be able to guide their children through that step-by-step constructive problem-solving approach. They should be able to understand potential hurdles that they may encounter in that problem-solving process and come up with ideas for overcoming them. They should be able to identify changes that they and their child has made since starting Fearless, and also know how to continue progress they've made throughout the program at the current time and then in the future, and to plan ahead for high-risk situations. And sometimes when we hear high-risk situations, we think about risky situations that we might be placed in, our children might be placed in. What we're talking about here is situations where a parent knows, or a child or teenager is able to identify, I'm likely to get really anxious in this situation. Has a high risk for kind of triggering me or poking that part of me that I know. So I'm going to plan for what I'm going to do when I'm in those situations that I know will probably be really anxiety producing for me. The other thing parents should be able to do is to set further goals and decide how to achieve these goals. It's really important that parents know that this doesn't only apply to them when they're sitting in class. This is something that we hope gets dog-eared, that people go back and forth and use over and over again, and then also are able to set down because they've integrated these strategies into everyday life. So, right. So I did want to give you a little more than just kind of the one slide of information on what session these sessions included. I'm curious if, it's hard for me to see all of you, but I know that some of you may already be trained in Fearless because there's a lot of training going on right now. and there are trainings coming up. So if you happen to be someone who's already trained in Fearless, or if you are attending one of those trainings, I'd love to see a little hand up to know how many folks are familiar with the program or already in the midst of being trained. Great. Awesome. All right. So one thing that we do know for sure is that anxiety impacts everyone in the family. When a child or a teenager is anxious and experiencing anxiety, it impacts the whole family. And Fearless Triple P helps parents learn strategy for anxiety management and then encouraging them to apply those to all of their children and themselves. Fearless in the first session and in a couple other subsequent sessions, particularly around the fear ladder, it is very good about giving some models for how to share with the family the benefit of what they're doing. Sometimes a child who is anxious, a teenager is anxious, is going to say, well, are you taking this class because of me? And the answer can be, yeah, I want to be able to have some good strategies for helping you cope with this, but also everybody gets anxious. And it's important that we as a family have good and healthy ways to deal with anxiety. I do want to let you know that if you are a parent educator and are trained in Triple P, here are some things that you're going to be able to do effectively and efficiently. Parent educators trained in Triple P are going to be able to be aware of the significance of child and teen anxiety and also have the tools to assess child and teen anxiety and family functioning. They're going to be familiar with Fearless Triple P program, content structure and delivery, variants, and the rationale for that. You'll be able to use behavioral rehearsal to help parents coach their children in effective anxiety management strategies, and also able to help parents transfer Triple P strategies to different situations and behavior. So what they learn about a situation that they're learning in class, they're going to be able to transfer those strategies to different situations as well. Also, you'll be able to use the self-regulatory approach when responding to parent questions and give parents constructive feedback regarding implementations of strategies. And you're also going to be able to address parent resistance and other common process issues. We all know that as parent educators, we oftentimes are sitting in a situation where there is some resistance. And one of the things that Fearless Triple P practitioner training does is help to teach some really good skills to address that parental resistance and other just general common process issues. I'm going to tell you a tiny bit about some outcomes. If you are a data nerd, if you love data, let me know and I can email me. My email will be at the end of this presentation, but you can let me know and I can send you some links from Triple P Global and Triple P USA that really can let you do a deep dive into some of this information and the research that went into creating Fearless, and also the data around the outcomes that I'm sharing right now. So Fearless Triple P produces outcomes for children with anxiety disorders that are comparable to anything reported for child-focused CBT and are sustained over time. It also has a positive family level ripple effects. Siblings anxiety reduces as well. And there appears to really be no difference in outcomes between the delivery modalities. So whether a parent is engaged in a 6-week course, in a one-on-one 6-week or 6-session situation, the workshop, they are, there's really small variances in the efficacy of those. And there really appears to be very little difference in outcomes. So if you do really want to do a deeper dive about the data used to measure these outcomes, or just in general, the creation of Fearless Triple P, please let me know and I can send you some links to be able to take a look at those and do that deep dive. So why choose Fearless Triple P? Why would you want to include this in options for supporting parents in your community? Well, one of the reasons is the higher prevalence of anxiety in children and teenagers. The need for resources for children and teenagers struggling with anxiety has increased. This is data shared by Triple P USA, and it highlights the rise in children and teens diagnosed with anxiety. The numbers rising from a little over 9% between 2016 and 2019 to a little over 20% in 2021. And most of us have experienced that uptick firsthand. We do notice that right in the middle of that was 2020. And I think all of us, unless we were a robot, the prevalence of anxiety for everyone increased during that period of time when we were unsure about pandemic things. So the wait for clinical services can be really long and frustrating. And Fearless equips parents and caregivers to have positive impact in the lives of their kids, even before a therapeutic intervention is available. And also, while their child is benefiting from therapy or counseling, it is a great companion. Another something that's really impacting the need for integrating a Fearless Triple P into the suite of things that you can offer parents that you work with is workforce shortage. According to the Kaiser Family Foundation, 90% of Americans believe that the nation's in the midst of a mental health crisis. And I am probably preaching to the choir right now saying that. And also that nearly half of the US population, about 47%, or 158 million people, are living in a mental health workforce shortage area. I'm probably also preaching to the choir when I bring that up. So how about Triple P in action here in Knox County? We, like everyone else in the world, we needed to figure out how to do things a little differently in the spring of 2020. Triple P did a really good job of keeping us up to date on ways to do that were helpful, virtual, and the other Triple P things that we were offering parents. However, during that period of time, they also let us know that there was some exciting stuff coming down the pike. And one of those things that we learned about during the height of the pandemic was that Fearless Triple P was going to be available in North America. One of the things that I knew for sure was just from being a parent and serving parents in the community that our children and children and teenagers were struggling with anxiety in a really unprecedented way. So during a Triple P webinar, not unlike this one, we were introduced to Fearless, and I started bugging Triple P USA about the possibility of US provider trainings. And I bugged them, and I bugged them, and I bugged them. And they kept saying, it'll come, it'll come, it'll come. I was super impatient. I also was kind of like a dog with a bone, and I just wanted to see if there was any way that we could be trained. I did find that our Canadian colleagues were doing a Zoom practitioner training, and I emailed them to see if there was space available. And I also reached out to Triple PSA to see if we as US-based providers could participate, and there was yeses on both fronts. So in April of 2021, we had 3 providers from Knox County that were trained and accredited in Triple P Fearless. And we have offered Triple P Fearless since then. We've done the succession, either individual or most often we have done the succession over 6 weeks. We have done the one-day workshop. I've done that once. It is a lot. If it is the only way that parents are going to be able to access the information, we did have great responses from parents that participated in it, but it's a lot. And we've done all of these things both in person and virtually, and have found them to be beneficial on both fronts. And frankly, we didn't really know that we were trailblazers. We just knew that we wanted this level of Triple P in our community. We knew that the mental health crisis in our community and in the country was not going to get any better sooner, any better soon. And we, as parent educators, we knew that we were in a unique position to help parents learn how to implement 24/7 in their homes these strategies and ways to encourage their children and equip their children. We also didn't know that we were going to be the only county in the US that was trained, because I thought other people would be doing the same thing. And I realized that when we talked with our implementation consultant about 6 months after we had been trained and accredited in Fearless, that we were the only ones in the United States. So we were excited to work with Triple P to really work as being a pilot here in the US. And it was exciting to have Ohio and Knox County get on the map that way. One of the really fun things that came out of that is when the US videos were being made for the US version of Triple P, and we were able to have some Knox County parents that were able to sit in and be the participants in some of the workshop filming. So that was very cool. All right. Let me see how I am doing on time here. I feel like I am doing pretty well. You know, the wait in our area for a child to see a counselor or therapist on a regular basis can be really long. Sometimes they luck out, but sometimes it can be really long. And that's why Fearless is so helpful. It helps us support parents who are feeling powerless and frustrated, and to help their children cope with anxiety. Fearless helps equip parents with solid evidence-based tools to help their children and families cope with anxiety, and is really a really important part of our Triple P toolkit here in Knox County. I think one of the things that Fearless has really helped us identify is sometimes parents coming to us and attending some of our other Triple P classes and courses. It's helped us be able to help parents identify that some of the behaviors that their children they were struggling with their children, either at home or in school, are anxiety related. And when parents were able to help their children and teenagers better cope and manage their anxiety, some of those behaviors lessened or disappeared. And that has been a real important part of being part of our toolbox here in Knox County. And being able to be trained in a way that helps us identify that and not just kind of guess about it. It also helps parents recognize the coping strategies that they're modeling for their kiddos might be impacting the way that their children are coping with anxiety, and that can be a real game changer. When you are able to see a family go from really being overwhelmed and frustrated and afraid to really feeling as a family that they have the tools, it's really exciting to see. And much like other levels of Triple P, goals for change do include parents' behavior while supporting their children. Fearless, it uses standard cognitive behavioral therapy tools. And for parents whose children are already in a therapeutic relationship, that it's a great companion. And for those that this is their first step in helping their child manage anxiety, we feel really confident as parent educators that we are sharing solid and dependable information. So I do want to talk a little bit more about our experience here in Knox County and why I'm such a champion of Fearless. Part of that is my own experience as a parent of an anxious child. I had a daughter that her freshman year in high school was really having difficulty coping with anxiety. We had a great relationship with a therapist that she was working with Children's Hospital. One of the things that was really difficult for her was going to school, and we really felt so powerless oftentimes. It was really great for her to meet with her therapist. It was really great for me to have that 15 minutes, or 10 minutes at the end of the session to talk about what they talked about. But it felt like I like my hands were tied in a lot of different ways. And I also felt like I kind of like knew stuff, I felt like I knew like what I should be doing. And I felt I was scared as a parent, but I was also, because sometimes I was just making sure my kiddo was staying alive. Um, but I was also feeling really powerless. Um, and she really had some gains with her experience with her therapist at a children's hospital. And then the pandemic happened, right? So I can remember her saying, why, like, I've been back to school for 2.5 weeks. Why couldn't this happen when I didn't want to go to school? And it was really in that kind of 6 months after that, that Fearless came into my life, and I became a practitioner. But man, it really impacted me personally as a parent. I mean, and I think I'm going to share a little snippet with you about some parents' experience. But I want to say, as a parent of an anxious child, it helped me. A person who felt like I knew kind of what I was supposed to be doing. It helped me also interrupt some of my own modeling and some of my own ways that some of those short-term things that are good at coping for short-term, and I was turning them into long-term. And I started to realize that I was creating a pattern of avoidance for my child. So it was really, really helpful. Um, Also, I think as a parent educator, it gave, again, I talked about that second guessing. We know that anxiety impacts children and teenagers. We know that anxiety impacts children and teenager when it comes to behavior. We know that anxiety isn't just about the shy kiddo that has a tough time going to school or entering social situations, but sometimes some really aggressive behaviors. And one of the things that I think is really important about Fearless Triple P is it helps equip us as parent educators to be able to share that information with parents. So a parent seeing aggressive behaviors and saying, well, my child's not anxious, they're just difficult. And helping parents really see that connection there. And again, it's solid. It's CBT based. So it is something that if a child is in a therapeutic relationship, it helps, is a great companion. And while waiting for that, also helps parents be on the right track to be able to serve their kid as well. All right, I do want to share a little about a parent, and I could go on for a very, very long time about success stories and challenging stories that we've heard from parents. But I did want to highlight this one. This was a mom who did participate in our Fearless 6-week course. She actually participated in one that was a virtual course. So there it is, that is, I believe, as effective if you're doing a Zoom class as you are as doing this in person. So at the end of the school year, her middle schooler had experienced some real great difficulty going to school in the morning due to anxiety. He'd have panic attacks in the car. And she would also often let him wait till school started and then sign him in mid-morning. And by the end of the year, they really kind of identified that last 9 weeks, that online option was going to be the best for him to finish the year. And so she was very concerned. She took this course in the summertime. She was very concerned about her son going back to school and returning to school in the fall. And one of the things that she shared, she really implemented so well so many aspects of the Triple P Fearless course, but she talked particularly about the fear ladder being something that was a really important tool for her family. And she really identified it was for her family. The family started to use fear ladders. And so when it came time to return to school, he worked on a fear ladder to manage his anxious feelings. And she said, there were still some days he struggled, but they were few and far between. And I love the information that she shared with us that her son said. And this is a middle schooler. This was a middle schooler, an 8th grader. He went back to 8th grade. And she said, her son said having a plan and the confidence that he could do it was the key. And he said, Mom, it's not that I'm not anxious anymore. It's just that I know I can manage these feelings. And I think that is if you take away anything from chatting with me for a little bit today, is it is Fearless equips parents to be able to equip their children and their teenagers to not get rid of anxiety, because that's not realistic, but it gives them the opportunity to have confidence and a plan to make sure that they can manage those feelings and feel confident about it. All right. I think I actually went a minute over than I said my allotted time for presentation. So I will turn this over. I don't know if Nicole, you want to handle questions, if there are any, or if you want me to just kind of go through the chat, you let me know.
Thanks, Susan. I think that right now we can do just that and see if anybody has any questions. I went through the chat previously and didn't see any specifically there. So we can just open it up and see if anybody wants to hop off mute and ask any questions, or if you want to put something in the chat, and then we will stick around just for a couple of minutes. And otherwise, we will be sending out a link to the recording, and then I believe we can send out the slides. I want to look at, yep, Susan's shaking her head yes, and so we'll make sure that we'll get this content in front of you as well. But does anybody have any questions or comments based on the information they heard today?
Either means that I covered it really well or not enough.
No, I think this was a great presentation. Thank you. I'm glad I hopped on for this hour. My supervisor is actually in the training for Fearless these 3 days, like Wednesday, Thursday, Friday. So
that's awesome.
She will use it, probably have more opportunity to use it than I will, but I did want to hear about it, to encourage any parents that want to get on it online or have me set up a triple P for them. We have another person that also delivers most of our triple P. I'm not sure if she's trained yet in Fearless, but yeah. So thank you very much. I think personally you covered it very well for me.
Oh, good. Well, and Nicole, I don't know. I know that there's going to be lots of opportunity to be able to access a trained triple P provider when it comes to the Fearless in-person classes. And I think maybe seminar, but I think the online piece is still going to kind of be pay to play through triple P. I'm not, you might be a better person.
Yeah, the Fearless, there is not universal access to triple P online Fearless. We are supporting the rollout of the triple P online, kind of the standard, which is the equivalent of the level 4 for both parents of birth to 12, and then with the tween population. So that is what's currently available online. We continue to have conversations about, what could universal access to Fearless look like, but that is not available right now. But we are investing in a large training cohort of practitioners who then could provide the in-person or one-on-one group, all of those different modalities that Susan mentioned, to families across the state. We try to make sure that we get as much statewide coverage as possible to train providers.
Well, and Nicole, I think the other really amazing piece of that is not only are you doing a really broad-based training to be able to have, so geographically people have access, but you're also giving those trainers the opportunity to have the workbook. I believe you're 7 a person. So it's wonderful to be trained in triple P. It's really important to be able to then actually deliver it. And so I want to give kudos to you guys that was part of the plan.
Yes, thank you. Yep, you're right. Each trained practitioner will have up to 7 workbooks that they then are able to deliver the program to families. I don't see any questions. I see a lot of kudos and great job
Good,
for
good.
you, Susan. So feel free if you do have any questions after the fact or you think of something, you're welcome to email Susan directly. Her email address is up on the screen. You're also welcome to email anybody at the trust fund, and we'll make sure that we hunt down the answer for you as well. But I just want to thank everybody for the time this morning for joining us on our first April Child Abuse Prevention Month webinar. I have to put a plug that tomorrow is National Prevent Child Abuse America Wear Blue Day. Next Wednesday is Ohio Wears Blue Day. So please make sure if you're able to wear blue, take a picture with your friends, coworkers, family, post it and share it on social media. Make sure you tag us. And we just look forward to hopefully seeing you all on future webinars. And thank you so much for your time today.
Thanks, guys. Have a good day.